I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Lauren had a great question today that's very relevant, and it is, how do you support the immune system naturally, specifically the anti-infection part of the immune system, without medications to give you the best shot to dealing with the flu and other infections? This is very relevant as the hysteria about this season's flu is ramping up big time in the media. So let's answer this. First of all, we have to understand the immune system, and we have to understand that it's very complex and it has different arms that do different jobs. So when we're talking about a flu or an Epstein-Barr or a herpes simplex, if we're talking about a virus, we must understand that a virus is an intracellular infection, meaning it infects the cells or invades the cell to hijack its replication machinery so the virus can replicate itself and then burst out and infect other cells in the body. So if that's the mechanism we're trying to address, then the part of the immune system that is targeted towards that is the innate immune system, which is neutrophils, macrophages, dendritic cells, natural killer cells, and then the adaptive immune system, specifically the Th1 arm of the adaptive immune system. So that's the part of the immune system that we need to support and promote activation of so that we can deal with the infection. When that part of the immune system is activated, it's going to create inflammation, and in this case, inflammation is the proper response because inflammation is how it's going to eliminate the infection and cause resolution and healing of any tissue that was damaged. So part of infection is fever, and a common question is, should we let the fever go or should we suppress the fever? I am of the opinion that you need to let the fever go because the fever is a natural part of the immune response to the infection. If we suppress the fever, that could allow the infection to proceed, and if that infection has reached the brain, that can lead to debris fields in the brain that could lead to neurologic dysfunction, maybe neurologic autoimmunity. So we want to allow the fever to do what it does in helping clear the infection. Part of the question is, how do we do it without medications like steroids and antibiotics? Well, if we're using steroids, steroids are immune suppressive, so that would likely work against our goals of clearing the acute infection. Antibiotics are useless against viruses. So that the potential there is only for harm because antibiotics can damage the gut, making the intestines more permeable. Up to 80% of your immune system's in the intestines. So if we make the intestines more permeable, now that fire alarm's being pulled more often by, say, gluten or bacteria or other microbes. So now your immune system's having to be divided on the German front, the Russian front, the Japanese front, as it deals with virus, not only virus now, but bacteria and foods and other antigens as well. So antibiotics, especially in a viral situation, are no good. What can we do naturally to support the innate immune system and the adaptive immune system? Well, the good news is there's lots of natural herbs and vitamins that are supportive in this part of the immune system. When we're looking to support natural killer cells, vitamin C is huge, astragalus is huge, echinacea is huge. If we're looking to support the Th1 part of the immune system, mushrooms like reishi and maitake are huge, berberine is huge, glutathione is huge. So all of these things are very important to support the innate and adaptive immune response, specifically the Th1 arm, and helping you in infectious surveillance, and if the infection gets out of hand, and clearing the infection and causing tissue resolution. So this is a primer on the infectious arm of the immune system. I hope this gives you some ideas, Lauren, and everyone else out there who's concerned about the flu this season. Other keys to either preventing the flu or clearing it and getting over it as fast as possible is, obviously we need to support those specific mechanisms of the immune system, but then we want to also support overall health. So sleep is going to be huge. nutrition is going to be huge. So having the right good foods and avoiding the pro-inflammatory foods, including drinks like alcohol and those things. So again, it's a whole picture. We're putting the pieces together. It's not just, oh, I'm sick, what supplement do I take? That's just nutraceuticals. You're using a nutrient in the place of a pharmaceutical. To really incorporate the paradigm shift of the 360-degree web and addressing all the contributions is the best way to ensure that you prevent it, and if you get it, that you beat it quickly.